My name is Francesca Robinson, an instructional designer with APHSA, and I'd love to just take a moment to share a little bit about who we are and the work we're proud to do alongside of our members. So at APHSA, we represent human services agencies at the state, county, and city levels from across the country. We're a bipartisan organization dedicated to building common ground and generating practical solutions that work for people and communities. Next slide, please. So we aim to advance the well-being of individuals, families, and communities through three core channels: influencing modern approaches to sound policy, building the capacity of public agencies, and connecting leaders to accelerate learning and generate practical solutions. Our vision is one of thriving communities built on human potential. And next slide. And while we're on the topic of staying connected, I just want to make sure everyone is aware of the APHSA conferences that we're hosting in 2026 in Arlington, Virginia, New Orleans, Louisiana, Spokane, Washington, and Salt Lake City, Utah. You can find out more about these events at the events page at aphsa.org throughout the year to learn more about these conferences, including registration dates, keynote speakers, and different sessions. And then next slide. So APHSA also offers a career center, which is a dedicated job board and talent marketplace designed specifically to connect professionals with career opportunities designed across the human services sector. It serves as a valuable resource for individuals seeking new roles, advancing their careers, or exploring opportunities within the sector. And then lastly, before I turn it over, just a few housekeeping items. So as you see, this webinar is being recorded and it'll be circulated shortly after the event to all registrants. During the webinar, we are requesting that you put any questions for our presenters in the Q&A panel. The normal chat feature is disabled for this session. And then our panelists will try to type response to as many as possible live, but we'll definitely have time at the end to answer any questions. So with that all said, it's my pleasure to introduce our moderator for today, Greg McKay.
Thank you. Yeah, and you can pull that slide down. Good morning, everybody, and thank you for joining. I'd like to thank APHSA for making another one of these happen. My name is Greg McKay. I'm EY's Director of the Human Services for Government portfolio. But my relevant experience to be here today is I was a former director of Arizona's Department of Child Safety for several years, where program integrity was not unfamiliar to me, and we had a lot of growing pains throughout those years, struggling with some of the same things that are being talked about today. So I think it's a great, timely topic. I see by the turnout today, it's top of mind for many, many people around the country doing this work. So thank you for being here. We got a great panel, and I say that because I think it's well-rounded in that, there's prior government experience, there's prior kind of enforcement or audit or investigative type of experience. And then there's the folks that are experts at kind of building the operational discipline and muscle around these things to help mitigate some of these big problems everybody's experiencing. So from a point of detection and revealing things to dealing with them to preventing them from occurring in the future, I think we got a great group here to share some of this with you. So we have Gary Burke, and Gary is a partner at EY over the Forensic and Integrity Services. Scott Nemiroff, Managing Director, also Forensic and Integrity Services at EY. Steve Begg, he's a Senior Manager at EY doing forensics and integrity work. However, his background is from government. He's the former Acting Inspector General over the U.S. Department of Housing and Urban Development. So we'll welcome his prior experience as well today. And with us also is Steve Farina, who is the Acting Director of Audits and Vulnerabilities at the Center for Program Integrity at CMS. So, great turnout. Glad everybody is here. I think I just want to set the table a little bit that, some of this is about, obviously program integrity is about defending your finances. Obviously, over these years, I think that we have less of a funding problem and more of a confidence problem. Hence the title today. So, what we'll be kind of covering down on is not only the financial side, but how how important it is that every dollar reaches its intended target. And those intended targets are vulnerable people in our country. So when that doesn't happen, we see poor outcomes take place. And most of the people on this call I see are in government doing this work. So I'm sure you're most interested in best outcomes, for today's conversation. So moving on, wanting to talk a little bit about kind of the current state, how things maybe were years ago as it pertained to funding these social programs and the audit and compliance surrounding that, and what it's like today, like what's changed, what type of pressures the agencies are feeling. So I'd like to call on Steve. Uh, Steve B, I'll say, so we don't get confused. And Steve, given your prior experience as an IG for HUD, you obviously experienced and saw a lot of things over the years. What's different now? Can you give this group a little bit of a taste of what it was like when you were in your role and what you're seeing and hearing today? And maybe some just insights around how to best prepare and kind of go with the times here.
Thanks, Greg. Good morning, everybody. Um, as in the Inspector General community and at HUD, I was responsible for overseeing the audits and criminal investigations across HUD's programs. And a big part of that was coordinating with department leadership on how to address risks, fraud, improper payments. And I think what's different today is the emphasis at the agencies on being proactive. The expectations are different, they're heightened, and the gaps in information and data are now being filled with requests out to participants. So a lot of agency systems don't have the data points that agency heads need in order to evaluate the risks and make decisions around non-compliance. And so what we're seeing is a big push from agencies to say, where we don't have those data points, we're just going to go get them. And the expectation is that participants are able to demonstrate compliance proactively. The mindset is show us that you spent $1 correctly before you get $2, and we're asking for that information continuously. So I would say the mindset and the behavior is now focused in this area in a way that we haven't quite seen before.
Thank you for that. And Steve F, given your current role, I think everybody's probably really excited to hear some insights from you, sitting in the chair that you're sitting in at CMS. Uh, you've been around a while. I remember when we first met, you said you've been there for a long time, so you've seen these changes. What do you think then and now? What are you seeing?
Yeah, I think, and good morning, everyone. Thank you for having me. I think from the CMS perspective, so I've been at the agency 11 years. We have seen a lot of changes, even congressional action, in a lot of program integrity spaces. And I'm here primarily to speak about Medicaid, but Medicare and the marketplace as well. I think the biggest changes that I have seen, especially coming out of the COVID pandemic years, is statutory and regulatory focuses on beneficiary eligibility. Just last summer, the Working Families Tax Cut legislation, the budget bill, was passed that made a lot of changes to Medicaid eligibility and oversight requirements in particular. And I know a lot of states are concerned about what might be coming down the pike around the good faith waiver standard for beneficiary eligibility in Medicaid and the potential for state disallowances. This was something that Congress has been very focused on. CMS actually has been doing beneficiary eligibility audits since 2018, and we're seeing all of this culminate with these potential statutory changes coming in fiscal year 2030. So in the next 4 years or so, the standard for states getting waivers from potential disallowances for eligibility errors is going to be changing, and the bar is going to be raised higher. And I think that is coupled along with some regulatory changes CMS did in 2024 around beneficiary eligibility documentation standards. So those regulations, my understanding is they were from the 70s. It was talking about documentation on microfiche. I am a millennial. I had to ask what that was when I read that regulation. So we have updated those a couple of years ago to actually bring them into the 2020s, talking about electronic records, what that looks like in state systems. These are the things that when we CMS would come in and do an audit, we would be asking questions about your systems. How are the automated documentation being stored? What data metrics were you using to make income calculations and verifications and all of that? So I think there's been a strong focus, again, not just at the agency level, even within Congress, on some of these important Medicaid issues that have been historic problems for not just CMS from an oversight perspective, but I think states as well actually implementing eligibility and enrollment for their beneficiary population.
Yes, microfiche. That's one I haven't heard in a long time. So, okay, so both of you guys are talking about something that, I mean, from my own experience running a child welfare system, was the biggest problem that I experienced when I first, was appointed was just a simple lack of visibility across the entire, all the programs, across the business operations, just flying blind. I mean, you know you have problems, you have to solve those problems, but having an idea of how bad it is or where it's coming from or how to really have that visibility is just so critical. And I know that many of the people on this call experience the same thing, where first thing is front end program integrity requires serious visibility into what's happening. And I know that that's tough. So speaking, looking towards Gary and Scott here, Gary, from your end, I mean, you just heard a little bit of the government perspective. So this is tough. I mean, I know how this goes. If I had been in my old role when all of this stuff became media and political fodder over these last 6 months to a year, I know where I would have been. I would have been in my governor's office being asked, "What's going on? How are we? What's our hygiene like? Are we going to show up on a front page?" Um, and that's not to say they weren't concerned most about people outcomes, but I mean, that distracts systems so much that it erodes their ability and their capacity to do good work henceforward. So, from your end, guys that go out and really help solve these problems, help provide that visibility, help start detecting and discovering. Gary, why don't you give us a little snapshot of what you're hearing from government agencies and clients out there you deal with, and what you're doing when you first get in there.
Yeah, Greg, absolutely. Thanks for the question. Thanks for being on the panel today. You know, my practice, I spend the most of my time with state health and human service agencies, really at the intersection of operations, compliance, and data. And I think what we talk about most frequently are three competing ideas that are all moving forward different paces. The first is, the program's evolution. How are we getting funds to those vulnerable communities that need it the most? The second is, and Greg, you mentioned this, sort of the media coverage on some fraud, waste, and abuse or improprieties or alleged improprieties in the marketplace. And then three is really the compliance organization and the functions that are meant to help address that. And what we're finding is that the compliance and the controls associated with the programs and really the scrutiny is kind of lagging behind. So the question becomes, how do we go ahead and do a jump start into that area without focusing too much efforts on that while keeping our primary focus on getting the funds to those folks that need it and making sure those funds stay there permanently.
Okay, thanks. Scott, anything to add there?
And just to add on to what Gary said, and thank you all for having me on the panel today. I think what we're also seeing with some of these agencies is they have questions on what's the appropriate steps for how to move forward now, and where should you start. And I think we see gaps in some of the basics of what is our several processes and steps that we have in place to actually have a compliant program to drive greater outcomes. We see a lot of those programs are kind of documented in silos, maybe not as much transparency across an agency and across programs, which just makes it difficult to demonstrate all the great things that agencies are doing to remain compliant, but also more specifically be able to mitigate fraud, waste, and abuse and improper payments. So I think that's a great challenge right now that's facing the agencies is, how do we start to understand what we are doing so we can get credit for the things that we do have, and also evaluating a lot of the gaps that may exist in the programs, given some of the more recent news actions by the federal government, to start developing where an approach can be to start closing some of those gaps. So I think that's a common challenge we've been hearing more recently, and a great place to start, just to start to promote that transparency and visibility of where the effectiveness lies now and how can you continue to get a little bit better every day.
Okay, so um, Steve F, uh, what do and when it comes to your role, it seems is um, maybe after, I'm not too sure. You can explain after the fact when it comes to audits. I think there's a real lack of just general operational discipline and kind of a CQI approach to these things. So things don't bubble to the surface until an audit, and then everybody takes on kind of a posture of defense and kind of protectiveness. So what are you all saying or hoping from government leaders, state leaders, in terms of, how are they doing this kind of effective risk assessing and monitoring and determining, where that exposure is and what kind of operational vulnerabilities that they have that is going to come to this. What are you promoting or wanting to see from the states?
Mm. Yeah, I think, and it's funny that you mentioned, my group, obviously the title actually is Audits and Vulnerabilities. And we do the post-pay audits in my group, but we also do the risk analysis and vulnerability identification on the front end in my group as well. And we do it for all of the Center for Program Integrity. We actually use what's called the Government Accountability Office, or GAO, fraud risk framework. So every federal agency is required to implement this to identify fraud risks in their programs and come up with mitigation actions to address those risks. I'm happy to say CMS has been identified as one of the leading federal agencies in this work because of what we do within my group. We actually have, the way we implement this framework is we have a Vulnerability Collaboration Council, or VCC, that brings in all of our policy expertise. We look at our internal CMS data. We look at call center complaints from beneficiaries, and that's both on the Medicare and the marketplace side. And we also look at external information like OIG reports, investigations, DOJ prosecutions. We have a healthcare fraud prevention partnership, or HFPP, that some states you may be partners of, that my group runs, and they do data analytics as well across the healthcare sector. So we're talking public, private entities, law enforcement also provides data. And it really gives us that cross-sector analytics that no one player has. Even CMS, as big as we are and as much data as we have, we're not seeing what the private payers are seeing. And we use all of that to assess, for example, home health, DME, hospice. And we break down everything from policy requirements, either in the statute or regulations, guidance, payment policies that our contractors are using. And again, all of our data analytics to figure out where are the risks and vulnerabilities within home health and hospice, and what does either CPI or CMS need to do to fix that. Some of those things could be enhancing our existing audits that we have. It may be we need additional contractor support, program expertise, or it could be policy changes. It could go as far as sometimes we will submit legislative budget proposals for statutory changes. And all of this is really to get at what you were talking about, Greg, is it's not just auditing after the fact, it's figuring out what we can do to mitigate these problems going forward. And I wanted to highlight in particular for anyone working on Medicaid on this call, we actually put out a risk assessment template on Medicaid.gov. You can Google that. And it basically is the tool that we use within CMS to assess these risks. We've broken it down into various templates along with instructions. And there's a recorded presentation that we did a few years ago walking states through how to actually use this at the state level. It's been invaluable. And at the end of any audit that my group does, we always encourage the states to be using this risk assessment template as a part of their corrective action plan and to mitigate future risks.
Right on. So, okay. So Steve B. Uh, I mean, kind of, I don't know if it's the right way to say it, but Inspector General, I mean, that's more of like the hammer, right? We're going to investigate, we're going to find out what's going on, and then there's going to be potentially consequences. But when you're doing that kind of work after the fact, I think you probably would have a good idea of what blind spots existed within the agency. In your case, it's it was HUD, but I mean whether it's childcare or SNAP or child welfare types of services, any of these things, it's all pretty much the same. Um, just maybe can you share with us some of the common things that you saw that to Steve's point a minute ago could have been identifying those vulnerabilities in advance and mitigating those before someone like yourself and your group got involved?
Sure. I think at a threshold level, IGs are looking for participants to be doing some of the exact things that Steve F. described in what CMS and CPI are doing. So my prior office had an entire portfolio dedicated to going in and examining whether grantees had stood up a fraud risk management program. And the first piece of that is it starts with the tone at the top. It starts with a commitment from the organizational leadership to dedicating resources to this area. But then, the real work begins with program specific risk assessments. And so frequently we would see that there were anti-fraud controls in place, there were compliance controls in place, but they were fragmented. They weren't centralized, they weren't coordinated, and there wasn't accountability from senior officials for checking on them, monitoring them, testing them, and then using the information that comes out of those tests to make changes in the programs. Um, Another issue we saw was that some of the programs hadn't been assessed. So if you don't do a risk assessment, you don't have an opportunity to create controls to mitigate potential risks, and then you don't have the opportunity to test them. So a lot of this, I think, is at a threshold level, and that's where we saw the most common issues in audits.
Perfect. Okay, so good segue then into kind of data-driven program health checks. So, um, and I really think, and from past experience, leading a child welfare agency through its most difficult time, I think, in history, we were the worst in the nation by way of performance. So it was a tough spot to be. But what I noticed was. It's almost like contagious when you're in one of these systems. When something is falling down in one area, it just acts as a contagion and it impacts the entire life cycle of everything. And ultimately, it impacts the constituent down the line that's waiting for some type of assistance. So I spoke about visibility, not having any, so to speak. So so how about Gary? When you get in there and you're trying to provide visibility, and maybe some of that is just simple detection, but what data are you trying to kind of reveal and provide visibility so that then that organization can move to the next step, which is some type of discipline towards controls and so on to mitigate future loss. So, Gary, anything to add there?
Yeah, Greg, thanks. And you sort of touched on it, so great segue, which is, when you were running, your agency, you didn't have visibility. You didn't have a steering wheel or dashboard to look at to say where should you focus your time and efforts. And that's what we see a lot, is that risk is treated, monolithically as a single definition, whereas opposed to, having a broader perspective on what is the risks at each program, at each subrecipient, whatever it may be, and how does that roll up into a broader perspective from the executive layer or even a programmatic layer. Understand what programs have higher risk because of the underlying attributes. The other thing that I mentioned on this topic is, those that do risk assessments, it tends to be a one and done. You do a risk assessment, you put it on the shelf, and you kind of don't look at it until you have to do it again each year, each new program. And so a lot of what we're seeing from a best practices perspective is how can you use the data that you're generating in your operations, whether that's through corrective action plans, audits, trainings, monitoring results, whatever it may be, to influence that risk assessment on a more periodic basis. Some may want to move toward more real time. That's down the road. But it's how are you using your data, not just to go after where there could be data or leakage of funds or areas in which probably funds may have been misspent, but how are you going to bring that back to the starting point, which is evaluating your risks and what are you going to do to spend your limited resources addressing the most risky areas of your entire program?
Yeah, perfect. And Scott, when it comes to the types of things that executives or program leaders need to see more than anything to really understand the kind of real time health of these programs. Um, you know, what are those? I mean, what is it that when you're out there, you're trying to really illuminate?
Sure. It's a great question, Greg. And I think in order to provide those insights to a leadership level and a program leadership level aspect, I think some of the challenges we see in order to get that is folks think, all right, I need this big technology solution that's going to completely revamp my program to get better data into our process so we can get more visibility. Gary kind of touched on this. We look at the ability to provide these insights as a maturation to a potential technology enhancement down the line. I think what we encourage folks to do now is let's meet you where you are. What data and information do you have? How can you take those data elements and be able to create dashboards, analytics, potentially use of AI to be able to get those real-time insights? So it's not to avoid the question, Greg, but I think we want to encourage folks to act fast and mature along their process to get better. And it's meeting them where they are with the data systems they have now. And how can you overlay some solutions to be able to understand where your current risks are? How can you get as real time as possible? Once you understand those types of red flags within a program or individual transactions, then you can start to develop those remediation plans to get better outcomes for your constituents first, but be a better steward of taxpayer dollars in the near term while you redevelop these programs. So again, not to avoid the question on specific data points, but let's meet folks where they are. To take a wholesale change now, a plug and play solution likely will miss the mark. So let's figure out where you are today, use your data you have, and then let's figure out how you enhance that going forward.
No, I like that. I mean, I didn't like when somebody came in and told me they had the answers to my problems. That generally didn't feel so good. But yeah, I mean, you're talking about tech and AI. I mean, but the old siloed audits or lagging indicators or manual reviews. I mean, I remember they said, "Hey, you're operating the worst system in the United States," and I said, "Great. What? Why? Like how? Like what? Show me something." That's telling me. Well, there was just this reluctance in the organization to reveal the data that we had because they felt like, well, it might get challenged. It might not be, totally accurate. And then the media and then the politics going to get going on it. And I said, look, we have to have some type of visibility, directionally accurate, but now, so that's kind of the old way, but come a long way. So integrating data between these systems, and how possible is that for many state agencies, given their current state of technology? Predictive analytics and risk scoring and continuous monitoring. I mean, these are all the things that we all want and hope for, but from a point of readiness, if organizations don't have that yet at their disposal, it's a little bit tougher. So let me say, you brought up AI, so stay with me, Scott. You brought up AI and technology. So, where do you see the emerging opportunities there? I mean, everybody seems to think that it's the magic bullet for all things, but I think we would agree that's probably not the case. But, what are the opportunities in AI to make this work go faster?
I think the largest opportunity is with continuous monitoring. And what I look at as continuous monitoring, that's those real-time insights from a risk perspective for a program, as well as all the way down to the beneficiary level of as data and information comes in, how can we evaluate those items to risk score them or like find red flag scenarios? I think that's probably the largest gap from a technology perspective that creates an opportunity for advanced tech to really close the gap on that mitigation space right there. Those real-time insights, doing them sooner along in your maturation process, I think will reveal some of your control gaps which can give us a great opportunity to then remediate long term with a better plan. So that's where I would primarily focus efforts on advanced technology. Yeah, I think the second spot would be, Gary mentioned periodic risk assessments. There's an opportunity to also still leverage your periodic risk assessments, but how can you merge that process using advanced technologies to actually do that more often with a lower level of effort so you can uncover those emerging trends and risks earlier within your program instead of waiting for folks like Steve B to come in to find those issues at the end. So I think those are the two primary opportunities. There's a lot of other use cases out there, but in terms of these programs with the audience here, I think those are the two areas I'd look to first to leverage advanced tech.
Right on.
I think, Greg,
Well, Steve,
sorry, maybe if I can just add on to that, because I think Scott brought up a great
mhm.
point about technology and some of the benefits of AI. I think just to add to what Scott was saying, what we see a lot is that, the technology maybe isn't a silver bullet in all cases. And I think there's a confluence between bringing in additional technology and overstressing already stretched resources, right? Because the technology, AI or otherwise, are going to indicate red flag transactions, third parties, you name it. Then what do you do about it? And I think what we've seen is the worst thing that can happen is you have a technology that identifies a red flag and you don't have the ability to take action on that. So it goes back to what we were saying from a risk scoring perspective and how do you tweak that and refine that. So again, technology is not a silver bullet. I don't think it's a lot about the insights and expertise that go around it, both in the useful setup of it, getting the right data, but then also tweaking it so that the results that are coming out are truly flagging what is highest risk and that you have the ability to take action to and with to really drive changes in your program.
Yeah, great ad, because I mean, that's everything. When these organizations are generally capacity constrained to the point where, and it's not even just these big ones like SNAP error rates or childcare that we're all reading about. It's any time the lack of capacity in that organization and hence a lack of discipline, it just creates opportunity. And one of my biggest areas of loss and fraud when I first started was transportation contracts. Just because we didn't have any ability to monitor, we were just underwater across the entire enterprise. It permitted like 20 different transportation vendors to bill per head on all of our transportation contracts. So, what do we have? We ended up with a $25 million overspend on a line item. So, the point being, all of these things require kind of the readiness and the maturity to actually get it done without degrading more of the capacity of your already kind of embattled organization before you see any kind of return on investment. So I love that you pulled that out. Steve F., you know, President Trump, the administration put out executive orders over time for AI and really wanted to accelerate technology and adoption in America to see better outcomes. From your standpoint at CMS, are you guys are you seeing any effective uses? Are you seeing any areas you want people to kind of explore?
Yeah, I think this has been something that both from the White House down to our CMS administrator, we have been tasked with implementing AI wherever feasible, understanding to your point, it is not the silver bullet. A lot of these models, and it depends on how you're using it, but a lot of these models are constrained by sometimes data assumptions. We don't have end results from some audits that we've done that would help actually train it on real life modeling and what's going on the ground. But I mean, we have been considering AI use from everything from fabricated documentation review, right? If a fraudster is really doing their job well, everything's going to look picture perfect when you just look at a claim form or a medical record. But having tools that could help identify areas where there could be fabricated documents. I think there's some hesitation around using AI to actually make claim denials without a human intervention in that. So that there's a piece there where I think it is still important, at least with how mature the models seem to be, to have a human reviewer involved. But we could be using AI to actually help from like a medical coding perspective. Having the AI tool do a first pass through a medical record, identify areas that are not sufficiently coded, coded wrong, that then the human reviewer can actually go in and target their review in those areas instead of looking at a 200-page medical record. So that's more from the audit perspective, but we are doing a ton in CPI on data analytics, predictive modeling, and basically taking our existing fraud prevention program that we have and integrating AI models on everything from our Medicare to our Medicaid TMSIS data. We're actually going to be putting out, I know you had mentioned about tools that states should be considering. We're going to be putting out soon a tool called the Medicaid Emerging Vulnerability Dashboard, which we're going to be sharing through our Healthcare Fraud Prevention Partnership portal. So if your state is a member, you should be able to have someone who can access this from a Medicaid perspective. But it'll basically help states give them this data modeling and analytic tool being run by CMS. So if a state doesn't have the funding or the expertise in-house to develop something, they can do a drill down in their state of a specific service area. It can all the way down to specific providers that might be driving spikes in billing. They can do geographic and geospatial analytics through that. So we're trying to also see ways that us at CMS can be supporting states and giving them the tools that they need. And this is all being driven by AI, predictive analytics, doing things where these systems can intake different qualitative assumptions that I don't think pure like mathematical prediction models can do. And that's kind of bridging a gap that I think we've had for a very long time.
Right on. So there's a question out there, and this is the a very common, obviously, concern. So when these agencies are all dealing with, PII or protected information, so in one hand, you're really worried about violating any of that, but in the other, you have AI involved. So the question was about how do you protect PII when using AI? And I guess it's kind of a broad question, but I think it's just the general concern. So maybe not so much a specific answer, but how do you just kind of alleviate and dispel some of the concern, the specter of AI, and how it's going to open an agency up to people's personal information and worse off, make decisions, errant decisions that a human should be making.
Yeah, I mean, I am no IT specialist. I will start with that, but what I can say, and this is the benefit of the resources the federal government has from the president down, has been advocating the use of AI. And my understanding is we have been able to engage not just in HHS specific AI tools, but also leveraging private sector AI tools, making sure that they're all federal, compliant with all PII, PHI regulations. I have to say, I have very few things I've seen the federal government move fast on. This was one of them. Within a matter of a few months, we had 3 different AI tools that were made available to all HHS employees. PII, PHI could all be included in them, and it was all, FedRAMP approved and all of that. And so I think it really, from my perspective, it starts from the top. If your leadership is invested in it, they will find a way to get it done and do it quickly to help give you more tools to do the work that you need to do.
Right on. Well, you did pretty good for a non-AI expert, but that's the crux of it with people, really. There's another good question in here. I like this. It's the question is, why does the private sector, for instance, banks, have the capacity to use tech to assess and flag risk, for instance, fraudulent charges, but the public sector and human services are so behind and unable to adapt to it? So how about Gary or Scott? Gary, you want to kick that off, and Scott, you can pick it up. I mean that's a good that's a good one.
I mean, yeah, I mean, my first thought goes to the banks in particular have been under scrutiny at least since 1934, right? With some of the SEC and all the things they have to do with it. So there's legally mandates to do some of the things that they're required to do. But also, they faced a lot of scrutiny over time. I think we've seen in the press that they've spent hundreds of millions of dollars reacting to issues of noncompliance. And so they have already gone through sort of their wave of investing to prevent and detect so that they don't have these fines and things coming on the back end. Plus, they're losing money and reputation as well. The other thing I'd say to that is, they've invested for many of reasons, banks and other private entities in technology. And so they have a lot more nimble technology structures on average that allows them to use AI and use some of these advanced analytics to pull insights from their data. Some of my experience with the agencies is that there's a lot of improvements ongoing with technology systems, but it tends to move slower than in the private sector. And so I think for that reason, the adoption of AI in the government space, certainly lags behind what we've seen from the non-government sectors.
And just to follow up with Gary, I think with the current administration, you see active changes in how they're thinking about procuring these types of technologies and these types of contracts. I do think that will flow down to the state and local level. Just as a change driver there, you're seeing some flexibility arise within the federal acquisition requirements to allow these technologies to be purchased and be brought into the system more effectively. I think what we're hearing from Steve F is a lot of those changes are going to be tools that state and local governments can leverage and use as they mature their programs. And I think what we hope to see is state and local governments start to follow suit, so they can use those advanced technologies, they can be more nimble, and they can be able to catch up with the private sector a bit, so they can be more effective. I mean, I really don't think it's a secret that we're trying to move away from pay and chase here, people-based risk management actions in response. And we're really starting to focus on those preventative controls and those continuous monitoring detective controls to be more effective. One thing I want to share as part of that process is there's a lot of research coming out of academia now on what is the ROI of taking that approach versus the reactive approach and leveraging technology, and what's the expense of the reactive approach versus that proactive approach. Yeah, I encourage folks to look up some of that research, and some colleagues of Steve F now that are coming into the government to help drive that change. And I think what they're starting to prove is if we leverage these technologies, we look at the investment, we now have things to point to say we're going to save money in the long run because of the cost of investigations, because of the cost of litigation, and the time it takes to allow some of these risks to compound over time are now proving to be more expensive than if we be more nimble with technology to be more proactive. So I think change is coming, and I know we're excited about it. And I hope you all are excited as well to get more advanced tools so that you can better serve your constituents in your programs.
Yes, they are. I'm sure I'm sure they are waiting for those things. But so you hit on a little bit like preparing for these increased federal inquiries. I mean, are you reacting? Are you on are you on your front foot? Or have you been kind of doing this work? So someone like Steve Begg. So um and there's, I don't think that there's any way for agency leaders and states to, just kind of say, I don't want to know, I don't want to see. That's going to come home to roost pretty hard. So, but at the same token, with the posture of, this scrutiny and this distrust and this kind of, stuff hitting out there, and then clawbacks when you start thinking of how are we going to return what is discovered. So there's a lot of concern for, how much proactivity do you go and get at, and the outcome of that versus, okay, reacting to if and when somebody like Steve is doing an investigation. So with that, Steve Begg, what when you were doing the type of reaction-based investigations, what were some of the most common weaknesses you saw in I guess in HUD in terms of different program areas? Like what were the things that you saw in these things commonly that really kind of incited what happened or furthered what happened? Um, which made them kind of unprepared for someone like you to come in and do your audit and investigation and see the consequence of that. Any common trends?
Absolutely. At a really broad level, I would say a lack of process was usually the root of every finding that we had. And frequently in an audit context, uh, the auditors are coming in and they're assessing what the issue is, what's the condition, and they're always going to look to what was the cause of that condition. Frequently, we would see lack of policies and procedures. So, um, policies and procedures don't solve for everything, but having them gives you a foundation to train your staff on. It gives you a process to evaluate down the line. And some of what we're saying is kind of all coming together here. If you're assessing your programs for risk, you're building a policy, a procedure, a process to manage that risk, and then you're leaning into it, testing it, and acting on the results of that testing. You have a chance to be in a position to say, if an auditor comes in or if Steve F's group comes in and asks you what you're doing, you have a place to start from. Like this is our program. This is how we manage risk. The expectation is never going to be that you're 100% effective. No one can be. But if you have a foundation to start with and you have a process for testing how well that's working, and then you do something about it, that's really the root of everything we would see at an OIG level. And to dovetail off of what Scott was saying, there is ROI to this, and everybody who's on the call is in government programs because they're mission focused, right? The goal is to execute the mission as best as possible. If you build a program and a control structure around achieving your mission, everything else can kind of fall in line, and you layer tools on top of it. It helps fill your capacity gaps along the way.
Okay, so Steve F. So we're kind of I'm trying not to focus too much on the negative, but what any goodness you're seeing? I mean, you're part of an audits and vulnerabilities group. So how can leaders demonstrate to federal partners that they have control, they have visibility, they have good fidelity in their programs? Is there some good examples that you've seen and you can share?
Yeah, I think the big one is, at least again, CMS's perspective for Medicaid, we have a lot of tools and forums available to states. And it could be something like that data tool that I mentioned, where we're just providing a system that states can use themselves. We also have a Medicaid Integrity Institute where we do fraud, waste, and abuse training for state staff. And when it has been virtual because of COVID the last few years, but when we get back to in person, we actually pay for state travel to alleviate some of the financial burden on states. And it's a good way for states to not only hear directly from CMS about new regs that came out or new statutory requirements. States actually do trainings themselves for other states. So we do everything from auditing 101 to HHS OIG comes. They talk about their fraud trends and what they're seeing. It's a good way to share best practices. And states that participate in things like that, or our healthcare fraud prevention partnership, it goes a long way. One, because it should be filling some gaps that you may have within your state, either system or knowledge base wise. But it's also showing that your engagement with federal resources on these important issues. And that's not to say we might come in and still do an audit and find an issue and there could be financial recoveries associated with that. But it goes a long way to show that you have been engaged. You're doing risk assessments because you attended the MII training about risk assessments. And you can at least provide the documentation of what you're doing. I think getting back a little bit more to data, there are a lot of states that have actually been doing pretty well on their Medicaid data mining, integrating AI. They're partnering with different contractors to help support their state staff in doing that. And that's stuff we're doing in CPI, and we're seeing a huge return on investment. And I know like AI is the big trend right now, but even just automated system edits, these have been around for a long time. States can decide how aggressive to be within CMS. For DME in particular, we've been more aggressive with some of our automated edits in the Medicare space, and we've been seeing significant recoveries just within the first 2 weeks of using some of these edits. So I think the tools are out there. I think some part of it is just how aggressive is state leadership willing to be to implement them moving forward.
Right on. Thank you for that. So we're at 8:49, and there's some time for Q&A here. I know there's a long question in that Q&A that I'm trying to see. It's very small. So let me look at that and see if we can get an answer for this. So the question says, running to implement and use Gen AI is under the assumption that everyone is collecting the data to ensure the data Gen I is capturing the data correctly, right? So some systems are only creating the following only federal requirements. States have tried to collect additional data to address potential risk, but can't because the systems are only following the federal requirements. For example, labor exchange systems. This puts the state in a constant reactive mode, which stunts innovation and the ability to address risk proactively. That was a mouthful, and I think I kind of butchered it, but did anyone discern what I was saying there and wants to comment on that and take a crack at that? No, okay.
Greg, I can jump in and do our best shot here. So, um, I've done a lot of this work at the federal level and the state and local level, and this is not a common challenge if you have really limited data information or data quality issues. So when we walk into situations like that, I see two avenues to try to get better information for you to get started. One is of the data sets that you're collecting, can you also work with other programs that are collecting other data to find some commonalities in the folks that may be participating in a program where you can connect some dots to say, hey, I see individual A over here also working within another program. That program collects a little bit different data, so we can start to kind of bring those together. So having a bit of a fusion center across programs to collect all of the data and information available to see if there's some commonalities and trends with the beneficiaries of a program or subrecipients, also with geographical reach related to the compliance efforts, that can be one way to kind of bolster that data set. The second way that can be beneficial, at least to get started, is using external data sources that can be available to you to assess. So, as a direct example, I am working with an agency right now where they have some controls or concerns about beneficiaries of programs that they have some concerns about because of data quality issues. We've worked with them to be able to actually do a bit of what we term a forensic analysis to use publicly available information and data that doesn't require submission from the individual to collect additional information to really start to triage potential issues and if it identifies greater risk indicators for noncompliance or improper payments or fraud. So there are other sources out there that you can pull in information, which can help inform you on maybe giving you enough of an argument to address program changes to be able to have better data collection. So that's one way you can go about trying to see how you bolster the data you do have access to eventually make some changes to gather additional data sets that'll make you a more impactful program.
Right on. Okay, so in our last couple minutes here, to make it, so worth the time people took to spend with us today, I'd like each of you to just take, a 60-second lightning round and just leave people with, your best advice. What to do now? Whether it's from a point of, protecting the dollars or producing the right outcomes, the right services for the right person at the right time, and maintaining that trust and confidence that needs to really be reestablished. If you guys could just leave people with your number one bit of advice and insight, how about we start, Steve Begg?
Thanks, Greg. Yeah, I would say it's important for the leadership on the call to dedicate the resources and demonstrate the commitment within the organization so that it becomes a part of the culture if it's not already. And it starts with sitting down and whiteboarding out what are the biggest risks? What can we do about them? What gaps do we have? Where can we build into our framework the tools and resources? Steve F. mentioned that there's a lot of information coming out from agencies. Scott and Gary have touched on some of the resources and tools that are available to plug gaps. How can we fill those things and how can we demonstrate and create a record that we're active here? That way, if you find yourself reacting to oversight, you have a strategy to start from, and then you can be successful in navigating that oversight effectively um, and ultimately protecting the dollars that you have and protecting against reputational risk.
Right on. Thank you, Steve. Gary, 1 minute.
A lot to cover in a minute, but I think, we've touched on AI, we've talked about analytics. I think those are a bit table stakes, but maybe to echo a bit what Steve said with technology in the backdrop, is start with where you are. We all may want to go a different direction and end up in a certain different end place, but have a critical look at where you are and don't be, satisfied or unsatisfied with where that is. I mean, start with where you are and then make a good, reasonable roadmap to get to where you want to be. I think the other thing I wanted to highlight is, there's a life cycle that Steve B mentioned, lightly, which is, create a policy procedures, train people on them, monitor against them, and then based on what you find in the monitoring, take action. I think it's pretty simple, but I think it's really important to kind of think about that holistically. And then my final point is on training. We didn't talk a lot about training today, but I think as you have policies, it's important to train your people internally and also externally on those policies. Because if you don't train them, then I think the expectations of them following that is a bit misplaced. And then on the training notion, there's a lot of funding coming out. I'm thinking about the rural health funding in particular, where it's meant to go out to different parts of the country that is the most vulnerable in certain definitions, but also the most remote. And so how do you train those third parties or subrecipients to use those funds compliantly so that they're not giving them away or doing something inappropriately or not reporting properly because they just don't know enough about the requirements because they haven't done that sort of effort in the past. So I just want to underscore that technology is fantastic. We all need Gen AI. We all love it. But training, I think, is critical, not only for the adoption of technology, but also making sure that our folks know what they should be doing in their jobs and their execution of the programs.
Yeah, 1,000%. Operationalizing policy, rule, legislation is a huge problem. We could probably have a whole other webinar on just that alone. So good call out, Gary. Scott, parting minute.
Thanks, Greg. Yeah, I think what I'd like folks to take away from this is, this is going to take a village. We had a question on why banks and financial services are a lot more advanced in this space. They've really spearheaded the model of a three-line of defense risk management perspective with kind of prevent, detect, respond. Many of us that work in programs are really working on the front end of that first line of defense. We've talked a lot about enhancing second line of defenses with use of technology and monitoring. And then we have that response aspect from folks like Steve B on the investigative and audit side. I would really encourage you all to not operate in silos. Bring together the different folks that own the different lines of defense, work together to understand where they're seeing emerging risks, where they're seeing where they can make a greater impact. And don't assume that you can do this all within your individual teams. You're going to need those other insights, other views to really have a holistic program that can work together to be able to put together the best in class program you can to make sure every dollar gets to the right folks to have the greatest impact.
Right on. Thank you, Scott. So Steve F. Last one goes to you. Any parting plugs or parting advice?
Yeah, I think building off what Scott just said, just as an example of how we do this in CMS. So I mentioned our Vulnerability Collaboration Council. This is how we keep everybody within CPI and all of our different lines of business. We have a provider enrollment group, we have a data group, we have a fraud investigations group, we have my group, making sure that we all know what the left hand and the right hand are doing, that we're not auditing the same people at the same time, the same state. And this VCC risk assessment helps us do that. We also then take that up to the administrator's office level, and we have what we call a PI council or program integrity council, where we bring this VCC risk assessment information to the administrator, his deputies, and all of the other center policy leadership so that we are at the table when policy decisions are being made, whether it's implementing new statutory requirements or just other reg changes, that we are there and program integrity has a say at the initial phase of policy development, not after a rule goes out and we're trying to then catch up even within our own house about what's going on. So I think that is critical for states to have some sort of structure, whatever makes sense for that. And I do have two quick plugs here. I mentioned the Healthcare Fraud Prevention Partnership. I think all but 4 to 6 states are partners. If you're involved in Medicaid in your state and you don't know if your state is a partner, we have the list of states on our website. It could be your Medicaid fraud control unit that is a partner. It could be your state program integrity unit. But take a look, and we're encouraging all states again to become a partner if you're not already, or if your specific part of the agency is not a partner. We're happy to engage in those data use agreements. And we do have a new project that CPI has initiated that I want to flag for states. It's called the Fraud Tax Project. So this is something we're trying to do between CPI and state tax authorities. One, so that you all at the state can be recovering your tax revenue where you need to, and then you all have data and information about these bad actors that we don't have in CMS, and it gives us some other data and insights to help our own Medicare provider investigations. Happy to feel free to reach out to me directly. I could share my email with my colleagues on the panelists here, and we can get you in contact with the group that runs that if you're interested in participating.
Perfect, perfect. Well, thank you, Steve. Well, so we're at time. Just a couple thanks. Thanks to the panelists here for your great insights. Much appreciated. Thank you, APHSA, for putting this on, and most importantly, thanking everybody in attendance today for the critical work that you do to produce the best outcomes for our vulnerable people in this country and stewarding the tax dollars as best as you can. So everybody, with that, I'll say goodbye and thank you again for being here.